Um, with the work that I'm doing, and the focus of what we're talking about today is homeless youth, and specifically young people identified within the spectrum. And I put together a PowerPoint presentation not to bog things down, but to help us all be on the same page as we go through the process. So hopefully the information that we're presenting will allow you to process and then ask questions, and then process and then ask questions, so that we're all moving at the same speed. So if you do have any questions that you're burning to ask during it, don't hesitate to just pop up, and we'll have questions as we go through the process. Does that sound good? Jazz hands? Okay. Clicker is now on. Good. Okay, so why are we here? And it's really to begin the process. We are not going to solve homelessness tonight. I'm sorry if you guys thought that was what was going to happen. That is not what's going to happen. We wish that that's what was going to happen. But we're going to start the process of becoming active participants in meeting the needs of LGBT homeless youth in the greater Nashville community. The process of understanding what's going on in our community, the process of understanding how you can plug in and how you can make a difference, process what those specific needs are, taking all that information in. It's a very complex issue of homelessness, and it's nothing that anybody hasn't been able to find an answer for. We've been doing this for a long time at the Oasis Center. We'll get into the history of the Oasis Center's work and how they've been approaching this and where we are today. So the framework for the dialogue is that we're going to walk through national and local climates for LGBT homelessness, and then we're going to have an opportunity to ask questions about that information. Then we're going to get into the immediate local need and proposed action steps that we have, we as in me, I'm a team of mice in my pocket, have presented as a possibility. That by all means does not mean that's what's going to happen. It's just a thought process that I've had. And then we're going to ask questions about that. And then we're going to outline our midterm and long-term goals. And those are specifically something that the Oasis Center is approaching. And our director of street outreach and our drop-in shelter, Michelle Hall, is here. And she's going to be the subject matter expert on those particular initiatives. Okay, so from a national perspective, and some of these stats may not be new information to some of you, but 39% of LGBT youth are forced to leave their families of origin because of sexual orientation or gender identity. Family rejection is one of the single most influential catalysts for a lot of the disparities that exist for young people that identify with the spectrum. And 78% of LGBT youth will remove their family from their foster places because of hostility towards sexual orientation or gender identity. So they're being forced out of their homes, and then they're going into the system, and then the system rejects them because those parents that they're being placed with don't understand how to work with LGBT youth. So the cycle perpetuates itself. LGBT youth represent 40% of the national homeless youth population, and 39% of LGBT homeless youth report being involved in the juvenile justice system. When they're living on the streets, you're engaging in what we consider survival traits, or what's the word I'm trying to say? What's the word? Well, survival sex is one of those, but they're doing all sorts of things to survive. Survival sex is one of those elements, but they're also, petty theft, vagrancy, things that are getting picked up and getting put back into the system. So it's a very large percentage comparatively to the straight population within the homelessness greater status. Local disparities in 2013, the homeless population in Nashville was 2,300. Oasis Center served 300 unduplicated homeless youth, representing approximately 13% of the total homeless population in Nashville. Approximately 35% of those youth identified as LGBT, equating to just over 100 homeless LGBT young people in Nashville. From a historical services perspective, Oasis Center's transitional living program opened in 1992. And that program was a safe housing for youth 18 to 20 years of age for up to 20 months. They could stay with us up for 20 months. It was an open and affirming place for LGBT youth. All young people were welcome. Everybody felt like they could come to Oasis as a resource for them. We had 10 private rooms available. We provided GED and higher education assistance, job readiness and placement assistance, counseling services, life skill training, permanent housing transition assistance. Those are just a few of the things that we did above and beyond just loving these young people and supporting them as they went through the process. Unfortunately, those services, we lost those. And just to give you a timeline, in 2012-13, we were not awarded federal funding for our program. In 2013-14 fiscal year, the sequester occurred and nobody across the country got any funding. And then we reapplied 2014-15 fiscal year, and we again were not awarded federal funding. We scored a 98 out of 100 possible points on the scale and still not awarded funding. It is homeless youth transitional living is not a priority in the federal government's funding rooms. So Oasis Center funded the transitional living program independently over the past 2 fiscal years, which was an estimated line item expense of over $700,000 that we were basically paying out of our reserves to keep the program afloat, hoping that we would get awarded money in 14-15, of which we did not. So in June of 2014, we had to make a really, really difficult decision and close that transitional living space. It was very traumatic for everyone involved. For the young people that we were housing, as well as for our staff that had been working with young people for such a long period of time. Now, a lot of people don't realize how many shelters we have. Of the shelters that we have, who are they serving? So we've got, quite a few shelters in our community, but you'll notice that their target clients are very specific in nature. Men in recovery, AA, and Narcotics Anonymous. It's a halfway house. We shot, I must say that. It was a new one for me as well. Women in recovery, veterans chronically homeless, families, single women, families, domestic abuse women. Oasis Center is the only program that's focusing on youth in that specific target area. The other, all homes with community care fellowship, it's an emergency day shelter, so they're not providing any sleeping accommodations. Let's see, Open Table Nashville, they're a street outreach and an emergency shelter. They also do warming shelters in the coldest points of the year, which provides overnight sleeping accommodations. But during better weather, but it's just a day shelter. So there's very, very few shelters that are serving the target population that we're talking about. And when it comes to identifying as LGBT, those particular organizations that do serve men, or they do serve women, it's a very, very difficult process for our trans youth to be able to safely navigate those relationships. At the Salvation Army and the National Rescue Mission, you have to, or specifically the National Rescue Mission, they require trans women to be in the men's rooms, which is a very dangerous place for them to be. So it just completely eliminates any safe opportunities for trans young people. So that is the state of what we have to offer here in our community. All of these organizations are doing very, very good work, and they're working really hard. But they've only got so many beds, they don't have so much resources, and the population is not going down. If anything, it's moving up. Any questions about that information? Yes? How
many of those are religiously affiliated?
A lot of them.
And that's part of the problem.
Yeah. There's a lot of faith-based organizations that are doing this work. Some of them are more open and affirming, like Open Table Nashville. They're a faith-based, but they're very open and affirming, extremely open and affirming, like over the top. But they just have limited resources like everybody else. But there are those that we all know of that have been around for a very, very long time that are very Christian, specific based, require that you go to church, require you to do Bible study, require that you do all these things. And if that is not a part of your authentic self, it makes it really difficult to feel safe in your environment. Yes?
You used a term on an earlier slide that I didn't quite know. It was like undoubled or something.
Unduplicated?
Yes.
Meaning those were 300 So we saw more than 300 young people in a year, but 300 of them were unduplicated, which means that we may have seen through our doors 1,600 young people, but they were coming every single day. So there was 300 independent young people.
Okay, thank you.
Thank you for clarifying. Any other questions on that portion of the information, just on stats? Okay. Okay, what's our immediate need? What our immediate need right now is, in Michelle Hall, I walked into her office just last week, and I was tracking her down actually, and she was in our drop-in shelter, and she was staring at the monitor in our surveillance booth where we have 24/7 monitoring of our side door for our street outreach, for our young people to come in and get services during the day. And there was a young person curled up in a ball sleeping on at the doorstep. And she looked at me, she's like, she this every single day. And it just breaks her heart because she knows that that was their best option. And to them was their safest option, was being curled up in a ball on the side of the street, waiting for us to open our doors. So at this point, what we really need is just an immediate place and places to have safe sleeping. Young people can walk in the doors at 11 p.m. and walk out at 6 a.m., but they've had a night's sleep where they don't feel like they're going to be harassed. They've got a cot, a blanket, a pillow, a bathroom. You don't have to have showers. You don't have to have food. Just somewhere safe for them to sleep. You don't have to make it complicated. You can keep it as simple as possible, just on a very emergent, right now basis, so that young people feel like they have a place to go that's good from the front end. So where do we begin? I've outlined 3 steps. One is forming a task force to develop an immediate action plan. I can't do this by myself. And although I do this work all day long as far as focusing on LGBT young people, it is not my only job. So I need to bring a team of people in that are willing to help and try to figure out what the solutions can be and how we can tackle this problem. The good news is Dr. Jama Shelton, who is the executive director of the 40 to None Project of New York City, which is a division of Cindy Lauper's True Colors Fund. She is working nationally now, trying to work with every city that she can get in contact with on helping them formulate a game plan on, basically her goal is to eliminate homelessness for young people, specifically LGBT, but the sentinel effect is that if you can eliminate for LGBT youth, we can eliminate it for any young person. So Jama, who wanted to be here tonight, she had a previous commitment. She was going to fly from New York to be a part of this conversation. She's going to serve as our technical coordinator for bringing a national perspective. She's currently working with Miami and Cincinnati. Nashville is next on the list. So this is a target market for her. She was born and raised in Mississippi, went to the University of South, and now she is shaking and brewing in New York City. And she is an amazing person that is committed to being a part of the Nashville community and assisting. I'm willing to serve as the coordinator to just sort of the blocking and tackling, but we're looking for people that are community service agency partners, faith community partners, healthcare, law enforcement, local business owners, anyone that brings a finesse of understanding how to do project management would be the people that we're looking for. And we have got a list of this task force members. So if you feel like you want to sign up to be a task force member, which means that you're willing to come to some lunches, bring your own lunch, we're not a problem business. Fun in that. Or after here at Out Central or the Oasis Center, wherever, and we are going to come together and have some really intense conversations about how we can pull resources we need to make this happen very, very quickly. We're going to sit and analyze for 6 months. These young people need a place to sleep. The next step is identifying locations, which can say we accommodate 10 or more guests. So we're looking for like a space like this that has a concrete floor and has a bathroom down the hall. You can set up 10 cots and throw some blankets and sheets, and you can lock the door. It's a little loud with the music there and a little loud with the music there, but it's safe. So again, it's not a complicated ask. It does require people to step up and say, I'm willing to be a chaperone and stay awake and not out anyway. I'll make sure that no one comes in the door and no one's leaving and everybody's safe in managing that process. You have to review the liability insurance policy to make sure that the liability insurance on your facility would be covering whatever may potentially happen. Check lease agreement, distance from downtown Nashville. That's a key component. Our young people need to be able to walk to this location. They don't have money for bus passes. They are walking the streets of Nashville. So finding something that's within, Midtown, all the downtown district, they know how to navigate downtown, but if you're out in the burbs, it's going to be really, really difficult to get young people out there. That would complicate if you're going to transport them. That's where your liability comes in, you're transporting folks, versus you're just opening the door and letting them sleep in the close the door. So, if you own property or you occupy property that you think might be a good fit, there's also a list up here that says, contact me about property, and that would be a good place to start. The last thing is that we need to enlist volunteers who are willing to jump into action. That serve as overnight chaperones, laundry service for sheets and blankets, protein packs, hygiene kits, socks, hoodie, coat collection drives, blankets, sleeping bag collection drives. There's a multitude of ways that you can plug in. And if you're the kind of person who says, hey, put me on the list and shoot me out a note and say, these are the opportunities that exist, something eventually is going to hit with you and you're going to be able to jump on and say, yeah, I can do that. So we also have a multitude of volunteer sign-up sheets up here as well. So those of you that say, at least put me on the volunteer list, I don't know what I can do, but I want to be a part of the process.